So the treatment for knee pain that don't avoid an operation or a progression. And what I mean by that is we do as much as we need to, but as little as we have to preserve function and quality of life. Early on, that may mean activity modifications. So if you're going out there and you're doing things very aggressively and your knee's bothering you, then we think of ways that we can still get you out and doing those things, but maybe we modify it. So if you like to go backpacking and hiking, maybe we figure out ways that we put less weight in your pack or fewer miles or a little bit less change in elevation. So you're still able to get out and do the things that you enjoy without suffering the pain from arthritis. Other things that we talk about are over-the-counter medications, anti-inflammatories, acetaminophen. And there are a lot of really good medications, believe it or not, that do a good job early on in the process of developing arthritis that still allow you to do the things you want to do, but not necessarily abuse yourself. Physical therapy has been shown in a number of studies, strengthening the muscles, training the nerves around the knee, to allow us to avoid or delay an operation, such as knee replacement surgery. Certainly braces have a role depending on what your specific problem may be, and then also what your activity expectations may be. And then there's also an injection therapy. Now, injection therapy isn't just one injection. There's actually kind of 3 different flavors of injections. The tried and true, the one that's been around the most, is the steroid. The next up would then be what we call viscosupplementation, which is a compound called hyaluronic acid. There's quite a bit of data out on that. And then the newest that's garnering a lot of attention, a lot of excitement, are what we term the biologic injections. Those are going to be the platelet-rich plasma, or PRP, a procedure we do here called lipogems, and then also the amniotic injections. And while there's not a tremendous amount of data out there on it, some of what's out there is very encouraging.